Okay, good morning, everyone. I think we should probably now make a start, if that's okay. And I'm just having a look at some of the attendees joining, so that's fantastic. Brilliant. Okay, well, as mentioned earlier, my name is Fahad. I am the Assistant Director at Community Links, and we're part of the Catch-22 charity group. And I'll be moderating the workshop today, which is titled The Impact of the Pandemic on Young People's Mental Health. Before introducing the speakers and the presentations, just a few housekeeping rules. The event is for 45 minutes. And we'll be sticking to that time frame as best we can. During the event, if you have a question for the speaker, please ask it in the session Q&A tab on the right-hand side of your screen. And just please ensure you're in the session tab and not in the event tab. Otherwise, your question will be seen by the whole event. I will ask you questions of the speaker at the end of the session if we have time. If you would like to ask your question live on screen, you can ask to share your audio and video. And again, I'll bring you on screen. And again, if there is time for that. You can also use the thumbs up icon to upvote a question if it is something you are keen to ask to. And if you'd like to follow up on a question, I would advise that you just preface the question with the words follow up. Just quickly introducing our speakers. So our first presentation will be from the Community Connectors group, which consists of David Johnson Morgan and Geoffrey Kasozi. So just very briefly introducing the speakers. David is a community connector, working on the East London Foundation Trust Community Connector Programme. He has a wealth of experience in health and journalism, and he's focused much of his under and postgraduate education on biological sciences and social prescribing, respectively. Geoffrey has experience working within health and social care settings, and his academic experience has further complemented this with, again, undergraduate and postgraduate degrees in public health and health policy, respectively. We will then break for a 10 minutes Q&A after the first presentation, moving swiftly on to the second part of the presentation from Kirsty Magahy, who is the Assistant Director at Catch-22. The presentation will be on the trends in the London Borough of Camden's young people's mental health during the pandemic. Kirsty's been with Catch-22 for 6 years. She's got a significant experience leading programs and services in the voluntary and public sector. She has spearheaded youth services at a community-based hub called The Hive, which Kirsty will elaborate and talk a lot more about in due course. Their approach to supporting young people has been noted by the National Health Service as being an excellent example of delivering qualitative support to young people. So without further ado, I shall hand over now to Geoffrey and David, who will take us through the Community Connectors aspect of the presentation. Over to you.
Okay, thanks, Farhad. I'll just wait for Geoffrey to get the slides on the screen. I've had a few minor technical issues that weren't fully unexpected, but hopefully everybody can hear me and see me all right, and I'll get going as soon as the slides are up.
Yeah, I'm in that process now of sharing these slides. Sorry.
While you work on it, then, Geoffrey, I might just start then because we're on a bit of a time limit.
Yeah. Can you see me?
I can see you. I can't see the slides.
Okay. Me too.
Button at the bottom with the screen with the red slash across it.
Yeah, I'm trying to find that page where I can share, and I've lost it.
Geoffrey, not to worry. I think, David, if you make a start, and I'll see if I can help Geoffrey out.
All right. Okay. Yeah. Okay. So you have to bear with me and imagine these slides. But the title slide says, it's much along the lines of, hello, my name's David, and this is my colleague, Geoffrey, and we're going to be talking to you about the impact of the pandemic on young people's mental health, and specifically the Community Connector pilot program running in Newham Borough in East London. So I was quickly going to go over the contents. I'm just going to give you a brief background of the Borough of Newham. We're going to discuss 2 case studies, and then Geoffrey's going to finish off by highlighting the impact of the pandemic on mental health and health inequalities for young people specifically. So the context of Newham then, a bit of background. Newham is a rich and vibrant borough in East London with over 350,000 residents. In 2012, it hosted the London Olympics. It's home to a huge Westfield shopping centre and the ArcelorMittal Tower. And in recent years, it's become a real enterprise giant with increasing internal development, as well as links to the City of London. However, Newham continues to be one of the poorest boroughs in the UK. Residents of Newham face significant and increasing challenges due to a range of issues, including housing shortages, unemployment, and severe deprivation. So I'm just going to go over some of the pandemic impacts and talk about Newham pre and peri and post-pandemic. So these are some pretty shocking statistics that have only worsened due to the pandemic. Pre-pandemic, 1 in 25 people in the borough were homeless, including 1 in 12 children, which represented the highest rate of child homelessness in England. Child poverty is as high as 52%, and Newham itself is within the most deprived 10% of boroughs in the country, ranking 12th out of 317 local authority districts. Unemployment was at 14% before the pandemic, which was already double the average for London. Post and peri-pandemic then, Newham's recorded the second highest death rate per capita in the UK, and it has the highest numbers in London of employees on the government furlough scheme, a scheme which pays out 80% of salaries to employers to then pass through to employees. This is mainly owing to the huge number of people on 0 hours contract and in precarious employment situations. Moving on then into the Community Connector pilot program and just giving you some general background. Community Connectors are individuals who are people who link young people suffering from mental illness in their local community with activities and organizations that can help improve their quality of life. This can include linking young people up with wellbeing and health services, local community groups and organizations, as well as social groups and activities that can have a positive impact on their life. The ability to link young people will help create connections that can provide a safety net of social support to help the young people feel better about their well-being and where they live. So moving on to service specific and talking about how the Community Connector pilot service works in practice. We get referrals from multidisciplinary team meetings. We get them from health and social care professionals, from the voluntary and community sector, and even sometimes from the young person themselves. A community connector such as myself and Geoffrey will then contact the young person and arrange to meet with them, or as has been the case over the last year, to discuss virtually or over the phone their situation. Having identified any areas of immediate risk, we'll then spend some time with the person finding out exactly what they want to achieve, and then typically work with them to facilitate this for a number of weeks with approximately 2 to 6 interactions between us. The focus, wherever possible, is on self-help and support, as well as self-care and management, thus enabling the young person to access and use voluntary and community services and resources wherever possible, but as well as maintaining that person's independence. Young people are encouraged and supported to engage with services through a range of techniques, including motivational discussions. In the future, when we're allowed, we'll be able to physically escort the young person to a service or program of activities, as well as us doing our own research and introducing additional community options to them. Some specific areas of support might include information about local activities, information about interest groups, day centres, arranging support for the person to become involved, talking to the young person about issues like debt, benefits and finance, as well as enabling them to access specialist advice and support in these specific areas. Overall, our service works to foster social connections and build individual and community resilience, as well as to provide a level of practical support. Next slide, please. So talking about, I'm going to do case study A, and then I'm going to hand over to Geoffrey, who's going to do case study B and sum up. So this was a young 22-year-old man who was referred to us from the mental health nurse in the primary care network, which is a group of GP surgeries who band together to provide co-located services. This young guy has recently broken up with his girlfriend, and he's also lost his job over the summer due to the pandemic. He previously worked in a retail hospitality-based role that had been significantly hit by job losses due to the pandemic. He used to play a lot of team sports, but has significantly curtailed this activity in the last year or so for obvious reasons. And the referral that we got highlights the patient's background and the fact that he's depressed due to the loss of his girlfriend and job, and is also increasingly isolated due to the knock-on impacts of COVID and his inability to play sports due to this. Our call with the patient reiterated these same issues, We also discovered the patient was sleeping till late in the day, was experiencing intrusive negative thoughts, and feeling a general sense of malaise and apathy. The main outcomes that the patient told us he wanted was a job so he can move off of benefits and get his own place to live, and ultimately to re-engage with social activities and especially the sports he used to play. Next slide, please. So talking about the process and outcomes and what we did then. In terms of the jobs, we actually referred him to the Individual Placement Support, or IPS, which is an organization within our Elft East London Foundation Trust, which supports young people, or anybody actually, with CV writing, interview techniques and confidence, as well as actually finding and applying to jobs themselves. We also linked into a confidence building workshop, again, to really try to boost his chances at interview. However, obviously the lack of retail and hospitality jobs, which is where all of his prior experience really exists, presented a potential issue in finding him new work. In terms of his girlfriend and social isolation, we referred him to an organization called the Newham Talking Therapies, which is a 6-week, once weekly group course, which uses CBT and kind of group discussion to try to improve people's mental health and increase their socialization. We also referred or linked him up with a peer support worker, which is an individual who suffered from a similar mental illness to himself and now works for the NHS in terms of being a voice that he can.
Apologies, everyone. We seem to have lost David there for a quick second, but I think he was just sort of concluding comments on the fact that how some of the outcomes were achieved on that case study A. I think he was just drawing to a close, so I think it'd just be perfect timing if we move on to Geoffrey, who will elaborate on case study B.
Yeah, can you hear me and see me? Fahad, can you see me and hear me? Hello, Fahad, can you see me and hear me? Fahad or David, can anyone see me or hear me?
Geoffrey, sorry.
Yeah, can you hear me and see me?
We can now, absolutely.
Okay, right. I'm Geoffrey Kasozi, working in the Newham Borough as well, and I'm a community connector. I've been in this role for just over a year now, and I work for Community Links, who seconded me to go and work in the Newham Borough. Now, my case study is about an 18-year-old female who lost her job as well, and for that reason, she was spending most of the time in her room. She suffered depression and anxiety, but the good thing is that she never had signs of suicide. Case study B, the process is that when you go to the GP, just like she did, and she was referred to a psychologist, and also the psychologist referred this patient to us, the community connectors. Now, when she landed into my hands, I supported her by advising her to apply for universal credit, because she never had money coming in, and universal credit, what they do is to provide people with facilitating them with costs for money for their living costs, and this comes in, could be every 2 weeks or monthly. I also referred her to our Newham Money, who also provide financial support advice. The other one was a mental health enablement officer. This was to encourage the patient and enable them lead an independent life, and also the individual placement support officer. This one helps with breaking down the barriers of employment. They support patients with writing CVs, covering letters, training them through job interview techniques, and also helping them to find flexible working hours with organizations, because as you may know, people who have suffered mental health issues may not be ready to go and work full time. So these are the people that help out in terms of finding out the hours that are suitable for people in this category. Then also Active Newham was helping this patient in providing online activities, because this person was at home doing nothing, so she needed to be engaged into activities that can help her. Next slide, please. Now, when I look at the impact of COVID-19 on health inequalities, these are differences in health status between different groups of people. Now, when you look at the case study, the young person we've just introduced to you, and the one my colleague David introduced you, they were in a certain category of their health status, but also we know that there are other statuses of groups of people who are in other statuses. Like, let's say one group could be rich, another one is richer, another one is too wealth. So our case studies, you find out that they had financial difficulties because they were unemployed. They live in Newham Borough, which is highly deep. They were in overcrowded accommodations. They were lacking on physical activity. And because of their low income, there is a chance that they were excluded digitally, because as you may be aware, that to be connected to the internet, you need Wi-Fi, you need to be making those payments so that you can be fully engaged on the internet. But they were suffering in all these areas. The other thing that we also identified was the access to healthcare. For example, if someone had COVID and was living in an overcrowded accommodation in Newham, what happened was to take that person away in quarantine, and what they did was to separate them away from their environment, and then take them like in a hotel and reside them there. That means their families and themselves could suffer anxiety and depression because their family member has been taken away and they can't see them, they can't even speak to them, they can't even provide them with food or ask them anything or even find out how they slept or how they feel. So that also was increasing anxiety and depression amongst the patients, but also the family members. So all these points that I'm mentioning here in health inequalities are interconnected. If one of them is lacking, the other one will also come in. For example, if a patient wasn't having enough money, that means they couldn't do shopping. And what happens was for them to be signposted to food banks. And now in England, food banks are charity organizations that give out food to patients who are hungry, and this food comes from churches, it comes from businesses and individuals and schools as well. So a number of food banks have increased in Newham of recent during COVID, and new ones have also emerged. So you can find out that because the money wasn't coming into the household, they had no choice but only to go to food banks and find some money. They were overcrowded. They couldn't do physical activities because there's no space for them to even do any activities. When they fell sick, they had to be taken away, and that was causing depression and anxiety, like I've explained. Next slide, please. Yeah, also the loss of self-confidence and self-worth. You can imagine if someone was working and doesn't work anymore, doesn't have money coming in, is overcrowded, doesn't have space to enjoy their lives. They are not even confident of the kind of treatment they'll receive when they fall sick. That brings down their confidence and self-worth. They feel as if they don't matter, they don't really mean anything. And finally, looking at the ethnicity, it's been noted that people from minority groups have suffered a lot in COVID-19. And when you look at the young people that we've just shared with you in this category, you find out that they fall under this category of ethnicity that suffered. And what they did was to increase stigma amongst these young people and prejudice and stereotype. they were shying away to go. Even now that there's been easing of lockdown, you'll find out that they will shy away to interact with other groups of people because they see themselves as that category that was identified as suffering more because of COVID and because of their ethnicity background. So health inequality has increased amongst young people from the minority groups, and also from areas like Newham that are highly deprived. Next, that's it. Thank you very much for listening to us. Thank you.
Thank you so much, Geoffrey. Thank you so much, David. Fantastic presentation. Apologies, everyone, for the slight technicalities in between. I hope you managed to capture all that. Conscious that we're running maybe five or 6 minutes behind schedule because we did start 5 minutes late, but I will quickly go to the Q&As and just see if there's any particular questions there. So Sean has made a comment in there about the scheme, that it's a pilot. So this is a question probably to Geoffrey and David. So how far into the pilot are you and how long is it planned to last? And potentially is there scope for a similar approach to be taken in other areas in the UK?
Great question. We're not really supposed to call it a pilot, even though it is a pilot, but we've been going for a year at the moment. And my understanding is that the plan is to roll this out to every other area in the UK as it's part of the NHS's 5-year plan for connecting up communities and connected care. So hopefully we've shown kind of proof of concept here, and over the next few years, depending on bureaucracy and some other stumbling blocks, it should be rolled out to the rest of the UK. I'm aware of a number of other authorities that are running either a program called Community Connectors or something called very similar and that does the same sort of role.
Thank you, David.
Yeah, just to add, I can see it progressing because our contracts have been renewed and we're expecting more community connectors to join us in this pilot. So it looks like it's something that is going to stay.
I think so. And just adding on to this fact, I've personally had conversations with other business areas, whether that's justice and employability, for example, where we think we can take this model and implement it in other areas. It's particularly within health. It's proven to be quite popular and quite, I would say, quite in need at the moment, particularly with the challenges the National Health Service is facing through its clinical services. So the element of a community connectors element coming in and providing a voluntary sector sort of social prescribing element to people's serious mental illnesses has been a really big sort of source of sort of support for clinical services based in the NHS. So I think absolutely echoing what David and Geoffrey has said. I don't seem to have any further questions in the chat, but feel free to come on board at the end of Kirsty's piece. So I think now is probably the appropriate time to hand over to Kirsty, who's going to be talking through her presentation about the Hive in the London Borough of Camden. Over to you, Kirsty.
Thanks, everyone. Thank you, Geoffrey and David. It was a really interesting presentation. I'm going to see if I can share my screen. Oh, that looks like it might be working. Gosh. Oh, here we are. Okay, everybody, so it's lovely to be here. It's lovely to virtually know you're all there, so thank you. My name's Kirsty Magahy and I'm the Assistant Director from Young People and Families within Catch 22. And today I'm going to be talking about Camden, which is in London. It's a borough, and talk about young people's mental health and how COVID-19 has impacted on them. So we just come from Newham, which is in East London. Camden is kind of a central inner city London borough. I think it's a lot smaller than Newham. We're very ethnically diverse. We are the home of indie music and punk music. And I think for those people who have been to London, you walked along Camden Lock, although Camden is much bigger than that area. You'll sort of see the kind of diversity and the kind of culture we have there. We have a lot of universities. We have the British Library, we have the British Museum, and we've also got platform 9 3/4 for those who are into Harry Potter. So there's a lot of kind of happening in the borough, and it's kind of very diverse. But within that, we have a huge disparity between rich and poor, like Newham. We have some of the richest people in London and also some of the poorest. And between that, there is a 20-year life expectancy gap. So if you're rich, then you will live 20 years younger than if you are poor. We also have the least affordable homes in London, which means it's near impossible for people to be able to get into the property ladder. And following on for this, we have high levels of poverty, deprivation and unemployment. I am looking at this, I looked at kind of where COVID was and where it was placed. These stats are taken from the 7th of April when I wrote this presentation, so a little bit out of date. As you can see, at this point, we had 126,000 deaths within the UK, which was very, very sad. And within Camden, we had 326 related COVID deaths. The young people, and I think this is across kind of the UK and probably the world, have been disproportionately affected by COVID and what it's brought for them. They are some of the people who have the least number of risks attached to them, but they're the ones that are suffering kind of youth unemployment and major issues in their lives. I oversee the Hive, which is a mental health and wellbeing service that works with young people aged 16 to 24 in Camden. That age group was picked because obviously it's that transition from child mental health into adult mental health, and that time in your life where you are becoming an adult. Often there's the assumption that at 18 you become an adult. That's really not the case. It is a long process of you becoming the adult and becoming the person you want to be with. The Hive was set up and we have kind of we work in various ways. One, we do one-to-one work, and that's mentoring with a focus on mentoring on emotional health, mental and physical health and practical skills. So a young person will come into us and we will very much work on where they are and what they decide they want to work on, where they're at. Often we very much follow kind of Malthus' hierarchy of needs, really kind of focusing on what young people need and where they're at. There's no point coming in to do some huge therapeutic work if you're homeless or you don't have any money for food. So we come alongside them and really work what they want to do, and we work in the community and also within our centre. We've got a lovely social hub which is based in North Camden, and it's a space where young people can come in, they can kind of make friends and socialise. We found that actually mental health is across the board. It's not just kind of having one-to-one therapy. It's actually looking at your whole life, being able to provide different skills, different places. And for a lot of our young people, it's actually making friends and meeting new people and knowing how to socialise and taking part in activities and being young people. And some of the most amazing things we found as young people who maybe come into our service who, you know, are suffering with you know, mental health needs, and they don't have friends and are able to do that, and so we work with them. So you know, they go out and have fun with their friends, which is what we do. We want them to live their life and carry on. A lot of the time we're working with young people who really need to go into kind of a secondary mental health service, and they're not ready, they're not able to kind of commit to that, or there's just something that's not really in their purview. So we actually work with them to do that. We also provide other services, so we link up with other people in the area. So Pulse is our sexual health service for Camden and Islington. Forward is our substance use service, and we also do employability. So we're kind of a one-stop shop. Co-production and with young people is kind of at the very forefront. They created the service, they work with the service. We very much respond to what they want, and that's all the way through the service. So we really set up to kind of improve that local health, mental health service for young people. We are commissioned or our contract is provided by the local council and the local health board as well. And we work in a partnership consortium, and that's what makes it work. So Catch 22 is a voluntary sector, but we work with staff from the NHS, our health service, from adult mental health and child mental health, and that's what makes it works. And our ultimate aim is to kind of really reduce the burden on other services in terms of depression, anxiety, mental health problems in the kind of vulnerable group that we work with, and work with them in a way that works for young people, that's very much designed around their needs and what works for them. So during COVID, as I think all of us had, it has been, none of us, I thought, ever would expect us to come to this point and be living this kind of life. So we've all kind of gone through a kind of trauma. I think before this, I think a year ago or 2 years ago, when obviously you guys were going to be coming to London, this presentation would have been very, very different. And what we found is, specifically for young people, is that life has very much come to a standstill. Things have kind of stopped for them. that transition into adulthood, that kind of marking from being a young person, a child, into a young person, and eventually an adult, is marked with kind of different special occasions. And it's also about when you kind of go out and you reach out and you're having relationships with people who are going to be there for the rest of your life, with other adults, with other young people, and then you become an adult. That has been gone, that has been taken away, and young people are very much like, well, there is no marking of special occasions. We're not celebrating birthdays, we're not celebrating passing your exams. All that kind of transition and those kind of major points where you become an adult have been gone. Our young people have reported significant loss of routine, structure in their lives, and insomnia. A survey was done with young people by an organisation called Mind, and they said that 1 in 10 young people felt at this moment in time they couldn't cope with life because of just how difficult it was. We found that our young people are using are on social media the whole time, and that's what they're doing. They're texting, they're tweeting, not tweeting, young people don't tweet, or our young people don't, Instagramming at like 3-4 o'clock in the morning, and that's what they do. They're very, very lonely, huge loneliness, which I'm sure this is not just pertinent to young people. This is across the kind of board, and not having places to be. I think a lot of young people have been sort of running around outside, but there's no places for them to be. And then, of course, that then becomes an issue in terms of security and are they safe? And young people with pre-existing conditions have really, really been exacerbated. So they've already got stress or anxiety, depression. These have been coming, these are coming back in force, and it's been very difficult for them. And also we've seen a significant increase in young people with eating disorders as well, whether they already had eating disorders and they were exacerbated or they were coming in. One young person we were supporting, we did an emergency visit to, and we realised that they hadn't actually been drinking any water for days, and they were quite unwell. And I think that was important, that it wouldn't have been picked up via a video call. Obviously, self-harming and suicidal ideation has increased. Our service already deals with quite a lot of risky people, and that's quite, it is something that we found has dramatically increased. People's physical health has declined as well. They're not going out, they're not taking exercise, and the kind of that domestic abuse, homelessness, conflict within the family, all of that has risen and become more dangerous for young people as well, and for people within the home. Young people have also, there's an increase in kind of gang and criminal activity. Young people who had maybe exited the gang lifestyle, or perhaps weren't involved in that, found that obviously with loss of employment, lots of structure, lots of routine, they were being sucked back into that. And also kind of the sheer kind of misinformation that's being out there, which led to young people being terrified of kind of going out. So we've worked across a different range of issues and trying to support young people through that. So obviously, oh gosh, it was a year ago now, my goodness, we went into complete lockdown, and I think like the rest of the world did. And we focused very much on two groups: those who were living alone and completely isolated, and those young people who were in overcrowded accommodations. Although everybody got a service, we just very much prioritised these people, knowing how difficult the next sort of few months were going to be. We were able to deliver we went completely virtual, bar for some emergency visits. We were able to keep the kind of same service, which very, very quickly we managed to move into that. But the emergency visits were actually crucial to our young people, so we could go out and see them face to face and check and get them into services when needed, which we believe actually save lives in seeing young people. Last summer we started to unlock, and we were able to do face-to-face visits at the service. So we maintained the virtual visits one-to-one, and we maintained the kind of social hub that we still delivered virtually, and then we had the virtual youth hub as well. But the important thing was that we had young people coming into the building. Often they'd never been out the house. This was the first time they had come, and it took quite a long time to get their confidence up in terms of getting into the centre. Now we are in a hybrid model, so we are half virtual, half face-to-face, and we've just opened up our youth hub at the start of the middle of March, which has been really good to have young people back in the building and having a youth hub provision where young people can come in, take part in activities and just be with other young people. And again, it's about encouraging young people to come in and being able to kind of share in those activities and be able to share in things like birthdays and those kind of big milestones which are important for all of us, but especially when you're young and that transition time. In terms of working to us as a service, so I think obviously being creative, flexible and adaptable and just being ready to kind of do anything, but I think being really proactive and reaching out. I think I think in the first lockdown, I think within a week we called every single young person on our one-to-one caseload and within the hub as well, just to reach out and say, what's going on? Are you okay? What do you need? Forward planning, we found the kind of bank holidays really, really difficult for young people. Whenever there was a change in government guidance or there was a big announcement that was made by the government, we tend to see a lot of young people had a lot of wobbles, and that's where we'd see an increase in suicidal ideation or self-harming. So we made sure that we had plans made and safety plans made with all young people. Young people really kind of wanted that routine and structure and distraction, which I think the kind of online youth hub really kind of brought in, that young people knew that they were coming in however many times a week, this is what they were doing and this is what they needed and really wanted. So we were quite lucky that we were able to kind of and very quickly kind of deliver that to them. And also I think, you know, working in partnership, how kind of caring for your team, and I'm sure that's what everybody here does, but just remembering that our young people are kind of going through loads and loads of difficulty, and you know, so are we. We're all living in this trauma and it's all really hard. That's the end of my presentation. I want to say thank you. I'm going to stop sharing, and then if you've got any questions, I'm sure Fahad will bring them to me. Thank you.
Thank you so much, Kirsty. Fantastic. A brilliant insight there into what goes on at the Hive Camden. So yeah, thank you so much. If anyone wishes to come on screen to ask questions, feel free to do so, and I can let you on, or drop some questions in the Q&A tab. Don't seem to have any questions just yet, but I guess, Kirsty, a question I had from my perspective was around how did you guys sort of pivot to a digital sort of approach to sort of engaging people whilst they were in lockdown? Because I guess the perception is that young people are quite digitally connected. We heard Geoffrey previously talk about inequalities, particularly young people who maybe live in poverty, who might not have access to 4G devices or 5G devices even, or Wi-Fi. But how did your team pivot to sort of engaging people during the lockdown phase?
I think sometimes it was quite difficult. A lot of young people have kind of learning difficulties, so sometimes it was like having one of our IT gurus in the team actually physically connect them with their computer and actually taking them through how to use technology. Often we were trying to find people devices or trying to organise access internet links and what have you, and obviously trying to pinpoint them to how they could get hold of it, but it was difficult. And I think we all started with we very quickly got into digital. So I think our one-to-one service, we were ready to kind of do that. We kind of written, you know, obviously there was a bit of warning this was going to happen. So we managed to write those protocols very, very quickly, and we would use WhatsApp to kind of do video calls, but it did. And I think it was a big combination, and sometimes it worked for young people doing that, and sometimes it hadn't. So especially some of our refugees and unaccompanied minors who English just wasn't their first language. It wasn't, you know, they didn't have enough of the language, and obviously, unfortunately, we don't speak the kind of variety of languages that we needed to. So they dropped off, but when we reopened, we managed to kind of get them back in. So, and some young people preferred, actually, some young people we found really difficult to engage actually preferred to do video call. They didn't want to come in and see us. So it has been hard, and I think we've learned a lot of lessons along the way.
Amazing, really, really positive stuff. I think our group is relatively shy because I don't seem to have many questions in the Q&A group. So we may be sort of finishing just on time after we initially thought we might be 5 minutes over. So if there's no further questions, just to say a massive thank you to all our speakers, to David, to Geoffrey, and to Kirsty. We shall be repeating this workshop again this afternoon. And just sort of in closing, so just say thank you once more to everyone. We'll be taking a break from presentations now, but we are starting back at 1:20 p.m. You can click onto the sessions tab and then into the panel section. But in the meantime, you have plenty of opportunities now to find out more about the amazing services through the Expo section. So please make sure you do visit that. But from all of us here, so thank you very much for joining, and we shall see you later on in the afternoon. Thank you, everyone.
Bye.